Our Mapping and Matching with the new Vulnerable and At-Risk Populations Resource Guide. My name is Christine Bevc, and today I'm joined by Matt Simone from the North Carolina Institute for Public Health. I'd also like to introduce our hosts for today. We are joined also by Dr. Ed Baker, who is the Principal Investigator for the North Carolina Preparedness and Emergency Response Research Center, and also the faculty member with the Health Policy and Management Department at the Gillings School of Global Public Health. As I mentioned, my name is Christine Bevc. I'm the project lead for the Vulnerable and At-Risk Populations Resource Guide here at the Institute. And Matt is also our lead geographer for the guide and joins us today as well. First off, we'd like to start with a little bit of background about the North Carolina Institute for Public Health, NCIPH. We represent the service arm of the Gillings School of Global Public Health here at the University of North Carolina in Chapel Hill. The purpose of this institute is to serve as a bridge between academia and partners in community organizations and government agencies. The institute assists local public health agencies with data collection and spatial analysis projects, including GIS technical assistance for surveys, pre- and post-disaster assessments, community health assessments, and all with the vision of being able to transform the practice of public health for all. Since 1999, we've been working to help deliver training, conduct research, and provide technical assistance to transform public health for all. Within the Institute, we also have the North Carolina PERC, the Preparedness and Emergency Response Research Center. This is one of 9 CDC-funded centers to conduct research on public health preparedness systems, which is what this center focuses on. Our center also works very closely with practice partners to ensure that the research findings themselves are relevant to the practice community and have the ability to be easily translated into practice. So as we begin, I want to quickly review our agenda for today. We have our welcome and our introductions. We also are going to review the objectives of the project, some background on the origins of the project itself, a virtual tour of the new website, which I know is what many of you are here for today, and also we'll conclude with a question-and-answer session before we close out our webinar. So our objectives for today are to begin to describe how this innovative mapping and resource tool really evolved. We'll be identifying several features and functions through a virtual tour of the new site, and we'll be talking with our practice partners to determine how you can utilize this new tool in your preparedness planning. So we want to give a very special welcome to our 3 guests today. We have Meredith Lee Vollmer. She is our Risk Communications Specialist from Public Health Seattle in King County. We also have Elaine Hallisey, and she is joined with Barry Flanagan, and they both, Elaine is the project lead and geographer, and Barry is also a social scientist working in CDC's Geospatial Research Analysis and Services Program, GRASP. And then lastly, we are joined by Betsy Kagi. She's our Academic and Special Projects Liaison with the Georgia Department of Public Health. And so they'll be joining us a little later in the webinar to talk with us more about vulnerable and at-risk populations. But we are very happy to extend a warm welcome to these guests. So just to talk a little bit about our project goal, this project was, when we began this project, our goal was to help local health departments incorporate at-risk populations into public health preparedness planning and exercises. And to do so, we recognized that there really was a need to help support and build the technological side of those planning efforts. Really by this, what we mean is strengthening and informing all levels of planning by providing theoretically grounded and evidence-based resources for local, regional, and state planning. When we started this, we also began to realize that though we originally focused on local health departments, we recognized and realized that these applications really extend beyond public health preparedness. So in addition to welcoming our panel, I'd like to take a quick poll to find out who we have represented across our audience. When we did this, we really wanted to make sure So we were also not only providing some of the mapping pieces of it, but also to combine this with finding the right resources for planning and preparedness, especially for those at the local level who may be new to their positions. So we began with a very grassroots approach to speak with local health departments, local preparedness coordinators, to find out what they needed to be able to complete their activities, their assignments, something that would not necessarily become a magic bullet, but maybe it's a little bit of an easy button. And so we found that this combinatory approach is really helpful. So it begins with the mapping, but then carries over to then match that to resources that are associated with those. And so our first piece that we had to work with was identifying some of the mapping needs. And so Matt is going to be talking a little bit about that component. And part of that is measuring vulnerability.
So the first part, the mapping, we decided we should try to pick a metric. And we thought about developing our own, and we also looked at everything that was out there. And one of the first things we realized is there are a range of metrics that are already existing. Many of these you may be familiar with. The SOVI, Social Vulnerability Index for Emergency Management, is a popular one. It's been around for a while. United Nations and the World Bank have sponsored several projects to plan for disasters. And these have resulted in development of the Disaster Risk Index, which is up there, as well as the numerous others present case studies testing the DRI at the local level. But part of what we wanted to focus on was just social vulnerability, which meant breaking down the risk model and being clear about what we meant by social vulnerability.
So I think this is a really good chance for us to take a moment and kind of pause and sort of differentiate between what we mean by vulnerable and at risk, and that there are differences between social and physical vulnerability. And so that when we're talking about populations that may be at risk, that risk is a relationship between hazards and vulnerability. And so the vulnerability are those characteristics of a person, group, and their situation, regardless of where they may live or otherwise. Risk, therefore, is the combination of that and the degree to which that vulnerability is experienced over a period of time with that physical geographic hazard. And so those may influence their individual capacity to therefore anticipate, cope with, resist, and recover from the impact of an emergency. So when we were reviewing all of these, Matt and I were sitting down and also talking with some of our partners to identify which metric we really wanted to use. And so we identified the Social Vulnerability Index for disaster management. This came out of CDC, and as a CDC-funded project, we felt that this was also a really natural extension of the work that we were doing. So this metric was introduced in January of 2011 in the Journal of Homeland Security and Emergency Management. And part of what we're going to talk about next is how this really begins to differ from some of the existing metrics that are out there, and also part of the reasons why we selected it and how it compares. And so what I'd like to do, Matt and I would like to welcome Elaine and Barry from CDC, who are actually the originators of this index, and talk with them a little bit about where this index originated from, along with some other elements there. So, Elaine and Barry, are you there?
Yes. You bet.
Great. Well, thank you for joining us, both of you. Start out with a real easy question, maybe not so easy, but how did you develop this metric?
Well, we had a multidisciplinary team. This actually started in 2006 with this team. There was a sociologist, demographers, some geographers, statisticians, developers, and of course public health specialists who recognized that we have a need to address social vulnerability. So after an extensive review of literature, the team identified U.S.-wide census tract level variables that can help us measure social vulnerability at a population level. And those variables, I think you've got another slide next. The variables that we looked at included poverty. There we go. Poverty, and those are the list there on the right. We have poverty, unemployment, income, education, older populations, children, those with disability, single-parent households, minority populations, people who speak English less than well, multi-unit housing, mobile homes, crowded housing, and households with no vehicle, also group quarters. And what we did was we ranked these individual variables just using a simple percentile ranking, very simple statistics there. And then grouped them into 4 themes or domains, and those are right there in the middle: socioeconomic status, household composition, and disability, and so on. And we determined rankings for those individual themes, those 4 themes. And then we combined all the variables and came up with an overall vulnerability score for each census tract in the United States.
So when we showed that list earlier of all the metrics, can you comment a little bit on how the SBI that you came up with is similar or different than others, like maybe compared to SOBI, for example?
Sure. As mentioned, we wanted to make sure that the SBI was simple, easy to understand, transparent, and accessible to everyone. So we just used a simple percentile ranking method. The statistics are very simple. It's U.S.-wide. I know that there are some indexes that have been developed that are pretty local, maybe regional, but this is U.S.-wide. It's at a small sub-county level of geography. A lot of the indexes that you'll see out there are at the county level, but this goes below county level. And also, I just wanted to mention that we looked at some recent work by the New York City Health Department. They were looking at indexes and how to incorporate them, the indexes, into some of their work. And they took a look at a number of different social vulnerability indexes, and they compared ours to their own local index as well as to the others, and our SBI came out favorably.
So what about some things that people should keep in mind when using the SBI? Strengths, limitations. You've talked a lot about the strengths so far, but maybe you could talk a little bit about the data behind each metric.
Okay. Well, first of all, let me just say that the data, you have to keep in mind that the data are at the population level. We're not addressing the vulnerabilities of individuals. So one of the things we suggest always is that state and local health departments use our SBI in combination with their own local information, their own connections, their emergency partners, preparedness partners, organizations, and also registries. So the SBI is kind of a starting point. It's an overview. It's a broad brush approach, and people can incorporate their own data. Another important point to note is that the rankings that we talked about, these each of the census tracts is ranked. They're not absolute, especially at the tract level, the small geography. The smaller sample sizes for some of the 2010 variables via the American Community Survey, which is produced by the census, as opposed to the 2000 census long form, makes there's smaller sample sizes, so there's an increased error. So the rankings are really less certain for 2010 than for our earlier 2000 version. So there is some, because we're dealing with sampled data for some of the variables, there is this issue of imprecision.
Can I just add, though, if a tract, say, is at the 88th percentile overall, or for some theme or what have you, the margin of error is not going to make it one of the best tracks, or it's not going to move it substantially. If it's 88th, maybe it'll drop 1 or 2 or 3, or move up 1 or 2 or 3. But basically, a tract that's in the 88th percentile is a fairly vulnerable tract, and that won't change despite the fact of the margin of error, which of course is a census-based problem, and it's anybody who's doing this kind of work is subject to that problem.
Right. We have to always consider our data source and potential problems here, limitations.
I think Elaine mentioned that we provide numbers. She may have said it in some other words, but yes, we provide numbers for each variable, and so that's, I think, an important point. In fact, that's one of Elaine's major contributions, is that emergency planners want to know numbers. So just thought I'd throw that in there.
All right, well, thank you so much, Elena Berry.
I had actually a few other, did you,
Go ahead, Elaine.
I had a few other things that I wanted to mention.
I interrupted her.
The SCI database is in MDB format, which means that it's in ArcGIS. It's a personal geodatabase. And you can also open it, however, in free GIS software. It's called QGIS. It works in Access, and you can import it into Excel. The database is available for download, so you can work with the numbers yourself. As Barry just mentioned, along with the index values for each tract, we also provide the raw data values for individual variables. So, for example, we have the number of people in each tract, age 65 and older. And that way, if you need to estimate, for example, the number of older people who may need to be sheltered, you can do that. I mentioned earlier, it's easy to incorporate the SVI into analyses with other data. And for those who don't want to deal with the data, we have an interactive SVI map that's online, and you can access that through our SVI site as well. As far as some potential uses, we've just got a phone call recently from the health department in Minnesota who said that they're going to be using the SVI as part of their budget formula to decide how to allocate their emergency preparedness funding. And there are a number of other projects. And currently we're working on something called psychometric validation to improve our further versions or later versions of SVI. And we appreciate feedback from you. Yeah, we appreciate feedback. So take a look at our website, and I'm hoping, Christine, that you will have a link available.
Yeah, we'll be providing that as well in the chat box.
Thank you.
Well, thanks so much, y'all, for sharing that information. And like Elena Berry said, those are a lot of the reasons why we chose this index as well. It focuses very specifically on a set of population groups that are easy to understand. It was constructed at the smaller unit of analysis for local planning, so not at the county scale, but at the census tract level. And there were different domains of potential vulnerability that we could easily get information from. So thanks again for joining us today, Elaine and Barry.
Great. Well, they'll be sticking around, so if you have any questions or that you'd like to ask them, please put them into the chat box, and we'll send them ahead to them as well. And that includes a link to their website as well, where you can see that data. And some of what's really exciting is that we'll be able to talk about how the different ways that we've been able to take the index that they've created and really begin to apply it in this new resource guide. And part of what we recognize is that risk is really relative. It varies by population. There are several populations over the past several decades that have been overlooked in some of the planning exercises, scenarios, events that have highlighted that certain groups of individuals may be more isolated from services, and where there may also be dependencies upon existing social networks within their communities. So a lot of what is being recognized is that many of these planning priorities really are local. They depend upon your local needs, your local planning priorities as well. And so with that in mind, we wanted to be able to address some of the challenges that we have here. In January of 2012, we introduced the original Vulnerable and At-Risk Populations Resource Guide. And this was developed as part of a PERC project. It was created as a starting point, or essentially a supplement to the planning process. It began with a short series of questions, 5 questions, and used that information to create a custom report that users could receive instantly upon completion. And so for our populations and health departments in North Carolina, we were able to then generate a report that would include those SVI maps at the local level, lists of tips and suggestions, as well as critical links to informational resources that included memorandums of understanding, PowerPoint templates, Word documents, links to additional resources, but really was to be able to create a concise report that local coordinators could use immediately.
So in this initial report, we supplied a set of maps, 5 maps, an overview map that kind of showed generally features on the landscape, a map shown here on the far left, which was the total overall vulnerability, and then the 4 domains that we mentioned earlier. But these were static maps, so we knew that it was a limitation, something that we wanted to improve upon moving forward.
So as we mentioned, this original project was introduced in January 2012. At the time, it was North Carolina specific because it was originally a pilot project. We were able to share this at the Preparedness Summit in Anaheim, California, and immediately began to recognize the need to extend beyond our home state and really began our efforts to outreach to identified partners across the country. We wanted to be able to make sure that the project continued to be very grounded in the practice needs and as well as informed by the current research. And so part of that process was making sure that we were able to work with other states and really continue to make sure that the planning could remain local. And so with us today, we'll be talking with 2 of our project partners. We'll be hearing from our partners in Seattle, King County, as well as Georgia. So we have Meredith and Betsy who will be joining us, and they'll be able to talk a little bit more about this. And so I'd like to welcome our first special guest, Meredith Lee Vollmer. Meredith is with Seattle, King County. And again, as we mentioned before, she works as their communications specialist and represents one of our project partners that we've had for over the past 2 years. Welcome, Meredith.
Thank you.
So to start us off, can you tell us a little bit about vulnerable and at-risk population planning in your area?
Sure. Here at our health department, we got started around 2006 with a group of people who are here within our department who had an interest in applying an equity lens to our planning for emergencies. And so we had started a group that we called the Vulnerable Populations Action Team. And as we started going through the planning, we realized that we really needed to involve many of our partners throughout our community. And so at that point, we started working more throughout the county, involving emergency managers, Red Cross, United Way, working with the specific cities that are within our county, and some of our other community-based organizations. And as that work progressed and we were finding that we were able to really coordinate on training and a lot of our resources together, it just made sense to go wider than that. So we currently work within our UWASI region that includes Snohomish County, Pierce County, as well as King County, Washington, and the cities of Seattle and Bellevue. And we've really realized that we can do much more coordinated to serve vulnerable populations and really do whole community planning as a region.
Well, that's really great. Can you tell us a little bit more about how vulnerability mapping has been used as part of this planning process and in the planning groups?
Yeah, well, we're so fortunate that we got to be in the early stages of this mapping project because it really does help us start to we do some of our planning. We've done it previously based on some strong gut feelings and some assumptions about where some of those populations are, but we don't often always know. We don't have access to the data, or we don't have time to really find that evidence base that really makes sure that we are making the most sound decisions. And so by having the maps, then we can start to really feel more confident in our planning and think about where very specific communities are. I think particularly by having it by census tract is very useful for us. So for instance, as we're thinking about where would we locate points of dispensation, so if we had to get medication out to our population very, very quickly, where should we put those pods so we can make sure people have access? Well, if we apply an equity lens, we need to be thinking about who is going to have barriers to getting to locations. If they don't have cars, how are they going to get there? Particularly because we have urban, suburban, and rural areas within our county. So by being able to look at the census tracts and see, for instance, where people have less transportation, then as we plan, we can start to think about, okay, where would we put those pods so that we can increase access and not amplify the disparities that already exist? Where is it that we should be thinking about putting our shelters if we have to provide medical shelters? For me as a communication specialist, by being able to see what the different vulnerabilities are in different areas, then it allows me to move quickly, particularly in a response, to see who is it that I need to be partnering with in order to communicate with the populations that have those specific vulnerabilities. So for instance, if we know that a particular census tract that has been affected maybe by a boil water order, if we know that they have a high vulnerability according to language, then I need to be thinking about how deploying translation resources quickly and thinking about the community partners that can best reach some of our limited English proficient communities in that region most quickly. So I think it has great value for us so that we're able to make decisions wisely, use our resources wisely.
I think this is really great. I think it begins to highlight some of the concerns that I'm sure that others also had related to vulnerable and at-risk populations in their area. Are there other concerns outside of the mapping that you've come across that may have been a challenge for you guys?
Well, there's always challenges outside of the mapping. I mean, always we're thinking about serving these communities that have poor health outcomes day to day. And so how do we make sure that we aren't, continuing to replicate or even amplify that? And I'm sure everybody else on this line struggles with that as well. So, the maps really help us identify where these populations are and give us the data behind it. I think it is always a challenge then to figure out how do we use that data in a very meaningful way, and how do we continue to engage our community partners, because for a lot of community partners, they themselves have a lot of other issues that are more pressing, and so how do we continue that engagement in planning for vulnerable populations, particularly when resources are tighter and we aren't able to fund as many projects through community-based organizations as we used to.
Great. Well, I think we'd like to go ahead and turn it over to our audience to enter into their chat box some of the concerns that they've had related to establishing and maintaining partnerships with stakeholder groups. And so we would have a poll here, but we've more technical difficulties. But in your chat box, if you can type in some of the concerns that you might have as an audience from our audience, for maintaining those partnerships with stakeholder groups in your community. And while everyone is sharing their experiences today, I just want to say thank you, Meredith, for being here and being able to share your experiences with our audience. And we hope that you'll be able to stick around for the question and answer period later. We've got a couple questions that have been coming in for you as well. And so we're going to pass those on to you through the chat box, and we'll come back to those during our Q&A period. But thank you so much for being here.
Thank you for involving us.
All right, and so as we continue to see those responses come in, we have Michelle Wilson, who is here in North Carolina, and she really, one of her concerns that she mentioned was getting community groups to see emergency preparedness as a health disparity, so something much broader than simply preparedness activities. Some of the challenges also come, Chris mentioned, the need for collaboration partners. Challenges also, Greg Neal mentioned, the need to have continued commitment from community groups is often difficult. And so many of these barriers and challenges that a lot of you are writing in about are also items that we've been collecting over the past several years as part of our evaluation process. And so in here, part of this is we were identifying some of the top external barriers. And some of that, many of you have already mentioned already. And so those concerns extend to the lack of resources to train community partners for preparedness, the lack of funding, a general concern, to be able to reimburse those agencies after an event. And really that top one there is that high turnover of staff and being able to maintain those relationships over time. But what we've also done is that we realize that there are also additional factors to successful planning. And some of those factors are not necessarily outside of our organizations, but that they may be inside the organization. And so there are a series of top internal challenges that were identified. And some of those reasons that we've heard from our users and many of the health departments we've talked to are that many of them may not have gotten that far in the planning process. There were challenges in not knowing how to begin the process, and of course the difficulties and challenges in assessing vulnerable and at-risk populations in their area. And so the timing of much of the data that we collected was back in 2012, so the timing is really with that release of the Bevc capabilities and the target capabilities, now the core capabilities, as well as the HPP capabilities. And so many of you have already gone through that internal assessment of where you are in the planning process, but still some of those other questions remain. And so as we proceeded with the project, we still wanted to be able to maintain that combination approach. So moving forward, we still wanted to keep the mapping along with the resources, but we really needed to decide where it needed to go from here. The original static guide for North Carolina simply isn't going to help anyone really outside of North Carolina. The applications were limited. And so in September of 2013, so earlier this fall, we received an additional supplemental funding from CDC to begin to develop a new platform, which we'll be seeing in a moment, that could then really help us begin to incorporate the ongoing discussions that we had with our project partners, really be able to take the feedback and the suggestions and the ideas that we've heard, as well as some of the evaluation that we've done from the original site to develop this new project. And so the project entered its next phase, developed on enhancing and developing that tool, migrating it to the new platform, as well as introducing several new features, the 2000 U.S. Census and American Community Survey data, and then also, very importantly, the multi-level mapping feature. So what we really aimed to do was incorporate that feedback and improve the features for our users. And so we've been busy since last fall. We started in September. We continued to gather and review the suggestions that we'd had. We had all of the ideas. We were refining and prioritizing those options right around the end of that year. And so for the past few months, we've been busy developing and implementing those. And today we have that new site to show you. Part of that was developing a more dynamic site so that there were lots of options and potential for interactions and opportunities. The multi-level mapping also meant that we had adapted metrics. So we're able to take the social vulnerability index and adapt it to varying footprints. So users who are entering the site from public health are able to identify maps that are specific to public health planning. For those entering for emergency management, would be able to see footprints and maps relative to emergency management areas or branches. And the same also extended for hospitals and healthcare. So in working with our project partners, we were able to identify those footprints for the 5 states. And so this was our pilot project, our expansion from North Carolina to our new 5 states. We also included an expansion of the resource list, as well as options to suggest those resources. One of the other feedback that we had gotten from our original users was that they wanted to be able to return to their maps and resources. Once they left the site, unless they had emailed a copy of the report to themselves or had found that email buried in their inbox, it was very difficult to be able to go back to where they started from. So now with the new site, we have that ability to return to those maps and resources. We're going to show you how you can do that. And then the other part is that option to be able to share with in-state. And this is something that was really suggested by our state partners to be able to provide resources that were state-specific. So for users who were in North Carolina or West Virginia, those resources could be added in, and then users could be provided with those exclusively. But many of the resources that we have are now available nationwide.
So to start all this, we literally started with a blank canvas. And this is not pretty, but this is how it's done. We took all the ideas and suggestions from the evaluations and looked at other successful sites. We worked with our IT partners and came up with this for our plan. And we're pretty excited to share this with you, but the site is going to have sections about the SBI, about how to use the site, examples of literature about the index and how it's developed. There'll be instructional how-to as well, resources, like we mentioned earlier. It's not just about the mapping, it's about tying that together with resources. An interactive maps and data section. And then finally, we wanted a place to share people's success stories as an example of how to apply the index and what works and what doesn't. So with that, we turn this ugly sketch into a pretty website.
All right, which is very exciting. And so this website is available at www.varpguide.com, and we're going to put that link into that chat box so that you can connect with it. And this is our home page. So we were able to go from that blank canvas and those chicken scratch sketches that we shared with all of our partners to be able to then come back to this new site that includes the welcome. It has the recent resources, the features, the different levels for those different areas, as well as some of the success stories. So let me just put that in there. All right. And so what we're going to do, because of some of the lag on this and some of the refresh rates, are that we're going to be going through some of the snapshots. And so you have the link to the new site if you want to follow along. What we have is our home page, and we've zoomed out on this, and so it's much closer whenever you're actually on the site. And what we also have is that top menu, which helps you to go through and orient. We have our About side, which includes information about the project team, background, and our partners. We also have a list of all of our project communications. Again, if you want to follow along, that's at VARP Guide, V-A-R-P Guide, G-U-I-D-E.com. And then we also have the how-to page, which includes how to use the site, as well as applications to practice. And so with keeping that in mind, on this page, this is how you can really begin to apply the guide to planning and practice. And the font is much larger when you actually view it on your own screen. But we wanted to be able to highlight that we've included the alignment with the National Preparedness Goal 1 framework. So you can see on the site and read through those specific capabilities and functions to which this guide is intended to help align. So it's designed to support these specific capabilities and resources. When we were designing the maps, the data and maps, we started with what did we again want to hear, what did our partners again need? And so the sketch that we had, all the different pieces that we wanted to include, what information, the ability to save, the ability to select the year, the different regions and levels and what have you. And so we now have our new mapping site. So our maps and data page really allows you to explore the different kinds of demographic data that's available through the SBI for our 5 states. And then also, so with this, what we're able to do is you can begin to drill down. So I'm going to pull up my highlighter so you can follow my cursor. I have my little spotlight here. And you can see where it's located right down there. You can narrow your search by selecting which location you'd like to explore. So here what we have is North Carolina. We've selected the public health preparedness and response regions. So it brings that level of footprints up. And then we selected the central region, which is where we happen to be sitting today. And then from that, by default, it then allows us, we can select which variable we want to view based on the available maps and data. And so what we have available are both the 2000 and 2010 SBI maps. And what we're illustrating here is the overall vulnerability. So if we think back to the index that Matt and Elaine reviewed, this is the far left column that shows the overall vulnerability and the combination of all individual variables. All right, and so the other thing that we can do, what we can also see here is we've switched over, and now what we're seeing is one of the specific domains. So we see that we've selected the socioeconomic status domain, and this includes that series of variables. This is one of the 4 domains, and within this, you can then also drill down for the specific variable of your choice. But in this case, we just want to hold on right now to looking at the socioeconomic status domain. And we see that again for the central region of North Carolina. And in this case, perhaps maybe there's a presentation that's coming up soon, or a report that needs to be completed, or simply the desire to save the map at this moment. And what we're able to do is then to use this camera, the little snapshot tool here, to be able to click on the image and save it and copy and paste it into another program. So when we look at it, we're able to then export the image. So this really allows us to begin to provide a tool that helps to make planning a local. It applies to regional and local planning and can really begin to help address the potential gaps that might be associated with those plans for at-risk populations. And with this slide, what we're highlighting is our 2 maps from North Carolina. The first is the Central Regional Office, and then also our CRI region around Mecklenburg and Charlotte. So these are 2 different maps where the Social Vulnerability Index has been adjusted to those particular regions. So when we're looking at each of those footprints, the information that we have within those map boundaries are specific to those regions.
We've had a couple of people ask for the URL. I just want to make sure people can access it if they want to while Christine's talking through it. On your toolbar for GoToWebinar, if you make sure to expand that, there should be an option where it says questions and chat. If you hit plus, you'll see from the North Carolina Institute for Public Health to the entire audience. There's a couple different URLs there. Christine's posted it. But again, it's www.barpguide.com.
All right. While you're looking at that, we'd like to take a moment to highlight some of the work that we've been doing in Georgia. And in terms of making this planning local and planning for the whole community, we can really easily see here how those footprints then vary between public health districts, emergency management areas, and regional coordinating hospital areas in the state of Georgia. And so when you go through the guide, you can also drill down and be able to select for your footprint and then your area. And so I'd like to welcome Betsy Kagi, our special guest today. She is our academic and special projects liaison for the Georgia Department of Public Health. And Betsy, are you there?
Hello.
There you are. Hi.
Can you hear me? Good. Hello.
Yes, there you are.
Good. I'm here.
Yes, wonderful. So For this, we had a couple questions, and I wanted to start with if you could tell us a little bit about planning in your area.
Well, I work for the State Health Department, and listening to what was going on in Seattle-Kings County is very similar, but at the state level, we're involved in trying to work with all of our partners and sort of provide guidance to the local levels. We actually have a coalition for emergency preparedness for individuals with disabilities and older adults that has been around for 7 or 8 years. It was developed after Katrina and the issues that were associated with the vulnerable populations and the impact in New Orleans. And this coalition has been very active for the last couple of years and includes state agencies like our Emergency Management Agency, Public Health, Family and Child Services, Division of Aging. The ADA has a big part about it, and we primarily go to their offices, the Red Cross, as well as non-government organizations and community-based organizations representing individuals with disabilities, including persons who are deaf, blind, have autism, and developmental disabilities. And it's been a very interesting coalition because we started out relatively slow trying to figure out how to talk with each other about emergency preparedness and educate each other on what each of our needs were from the preparedness side, but also from the side of the disability population as well as the elderly. We've put together a functional needs shelter support toolkit for Georgia, addressing some of the issues and needs that are going on within the state. We also provide training and things like that. But we also have a healthcare preparedness coalition that's coming out of our healthcare preparedness grant at the state level, which works. We're in the same offices with the public health preparedness grant, emergency preparedness grants, and we in each of the hospital, regional coordinating hospital areas have their own separate coalitions now, and their planning coalitions. What I have to tell you is Georgia has 159 counties, which is crazy. When I first got here, people would call up and say, I'm in such and such a county, and I say, okay, back up just a minute and think of a clock and tell me what quadrant you're in, so I could try to locate the county. But each of the agencies within Georgia have divided those 159 counties differently. So the map you saw on a previous slide on public health districts, there are 18 public health districts. There are 7 GEMA, which is our Georgia Emergency Management Agency regions, and there are 14 regional coordinating hospital regions. And they overlap because we're all including the 159 counties, but they are not the same footprint. And so that's what we've been doing as far as looking at how to provide information that is consistent across all of the counties within the state that each of the separate planning agencies can use and can talk with each other about.
Yeah, that's a really important point that Betsy just brought up, and that's the real value of this tool we've created, is that you can see the vulnerability relative to each one of those regions. So if you are from the regional coordinating hospital area, you're seeing your vulnerability relative to that restricted area, not the entire state. So it adds a little bit more context to your planning.
Mm-hmm. So one of the things also that we're showing on the slide is a snapshot from a workshop that was held last month on the Social Vulnerability Index integration into Georgia's online GIS platform, GoDogs. And we're going to switch the slide and show you what that snapshot actually looks like. And so, Betsy, could you tell us a little bit about this training, who was able to attend, and how did it go?
Well, you've heard from Elaine and Barry from CDC, and they were there and helped present, as well as Christine and Matt came down from North Carolina into the wilds of Atlanta. And we had about 35 attendees who brought their laptops to a one-day workshop, and the morning session was essentially providing background and information about Social Vulnerability Index, mapping, but also GIS and what the differences were with that, and I'm learning as I go along. And what I found out at that session was essentially that we were the first to work with Christine on putting this on our interactive Go Dogs. And Go Dogs is the Georgia Online Disaster Awareness Geospatial System, and it is housed in our Georgia Emergency Management Agency. They use it in response to different events. They have real-time information on there, on weather, on traffic, on everything else that you can put together, and there is a section on social vulnerability index that is going on. We're still working on it and trying to make it a lot more user-friendly, but we're in the process of doing this. And so during events, you could actually pull this up and integrate it with the some of the other response layers that they're looking at for depending upon the event. And so we had public health emergency coordinators at this workshop, local EMAs, because this tool through our Go Dogs GIS system is essentially set out for local planners, and we wanted to make it as relatively easy as possible, but also something that they could use to take a look at their local areas. Again, as Elaine said, this is not individual information, but it is population-based, but it provides them with a start. One of the things I've also found out that the local planners really do know, depending on the size of their community, pretty much know where their vulnerable populations sort of are in some areas, but this provides them with information that they can take to their politicians as well as their grantees and agencies to provide more support in their works. We also had some folks from the universities come and take a look at this. We also have healthcare, what do they call it? Healthcare liaisons, as well as some of our public information officers came and attended this. And in the afternoon, we provided a hands-on training of just sort of getting people to start looking at how this system works, and they were very interested. And what they want is, this is a relatively small group, is that there are other people around the state within the health departments in emergency preparedness, but also the EMAs and the regional coordinating hospitals who want us to take this on the road and do this kind of training locally so that we can do this, and that's what we're sort of looking at in the year to come.
Which is really exciting. So the slide that we've been showing is what the users in Georgia are able to see if they go onto the Go Dog site. And so right now we have the housing and transportation domain up, and then also the various features that are available within Go Dogs and that database, so folks can see the little purple and green dots are points of dispensing features that have been turned on, as well as the boundaries for the different EMA areas. We have Area 7 highlighted there, and then also where the various roads are as well, so you can see the different beltway around Atlanta there, which was all red during the storm earlier this year. So this is really exciting, Betsy. I'm so glad that you could be here to be able to share this with us today. Thank you so much. And we'll also
I met Christine 2 years ago at the Public Health Preparedness Summit when they first started talking about their mapping tool. And it's been a relationship that's gone on for at least 2 years and trying to get this integrated into Georgia's system. So it's been wonderful.
Thank you, Betsy. It's been so good to have you here. We want to switch. I think this has been really great to be able to highlight where you can take this new guide into the future and be able to integrate it into your own local system. And you can use the CDC data for the state level and also national values. And then with our site, you can get a little bit more local into those EMA regions, into the branches, into the hospital areas as well. And so really it is about being able to personalize the planning. And some of the additional features that we wanted to take a moment to highlight. For those of you who have been busy popping onto the site, you can bear with us. This is the first time we've really been able to push some traffic through to that site. So if you're having a little bit of difficulty pulling up that page, give it a moment and retry. This is also a great time if you want to put in comments and suggestions into that chat box as well. We'll be following up and meeting back with our IT partners So if you're having any challenges or issues, please let us know. As you go through, we want to make sure that you're also taking advantage of the opportunity to register on this site. So that's located in the upper right corner, and we'll show a screenshot of that in a moment. But when you register, you also have the opportunity to access an additional set of features. These include the ability to bookmark and like resources, and we'll talk about that in just a moment. You also have, that's where you have that option to be able to save the maps and data that you create, and then also to be able to have easy access to your My Page. And so if you look at the toolbar, that screenshot there, we've highlighted the My Page, so if you're not logged in, you won't see that link. But once you register and log into the site, you're able to view that page. And that appears there, so up in the upper right-hand corner. And again, I'm going to highlight that. You can register up there. So I'm logged in here with one of my accounts. And so this allows me to access my My Page. And so on my My Page, one of the things that I have is that I have the list of all of my saved maps, as well as all of my bookmarks. And so when you're on the resources page or the success stories page, you can look for these little bookmark links. So anything that you highlight and click that link on will then later appear here. So why don't we go, and I'm going to do a virtual interactive on this, and we're going to go and save a map to our MySpace or a resource. So when I click on the resources page, what I have here is a big long list of all of the resources. And so I can select any of these resources based off their specific partner type or the population type. So that gives me an option to view those resources specific to those filter categories. And again, you can create your account through these links here. But it takes this big long list because we have I think we have nearly 200 resources at this point that are in here. And you can begin to select those as well. So in this column here, you can begin to see those that are circled that are bookmarked resources. And then also the liking. So just like Facebook, if you have an account, you can like something, and we have that functionality that's been added into this site. So you can see if others have liked a particular resource and potentially recommended it to others. You can see those that are highly ranked, as well as those that you personally like. So maybe you don't necessarily want to bookmark it at this moment, but you want to like it and say this is a good resource and be able to recommend it to fellow users. For this, when you go to Maps and Data, you can go through, and so here we've selected Washington State, and then drilled down into the counties, and we've selected King County, and what we're viewing here is the housing and transportation domain, and specifically we've selected the variable within this domain for no vehicle available. So as Meredith was saying earlier, being able to identify where populations might be that might not have access to vehicles to be able to get to those points of dispensing. This is that layer of the map that might be interesting to be able to take to meetings with stakeholders and activity partners. And so maybe you don't want it right now, but you want to save it for later. And so over in the upper right-hand corner of that map, you can bookmark it by selecting the little bookmark icon and give your map a name so that you can find it later. And so what we've done is we've labeled it no vehicle, or we've abbreviated it for King County, and then we click on the Save button. And so now, if we go over to North Carolina, say that we want to save this map that we've created. And what we have now here is the list of all of the maps that we've now saved. We've pre-populated this from before. So we have that map for the no vehicles for King County that have been bookmarked, as well as the overall vulnerability for the CRO region. So you can apply whatever label you want to save these maps that you can go back to. And one of the other maps we created was socioeconomic status for the Savannah area. So you can name it whatever you want to name it. And then also for the bookmarks, we've selected a set of different resources that we might want to come back to a little later. And then also a series of a couple success stories. And so that's how you'll be able to use your My Page to be able to find things. And something here is that if you don't right now, their maps are not available for your area, you can still go through and be able to bookmark and like various resources and success stories. So one of the things we didn't get a chance to touch on were the success stories. These are vignettes, small vignettes, that highlight different ways that local planning is taking place, some successes, some lessons learned from various previous events, and they're not specific to the use of the Social Vulnerability Index, but they are thematically geared towards planning for vulnerable and at-risk populations. So we're looking for new stories if you happen to have them. One of the things that you can do when you click on success stories on the site and your page, when you click on success stories up here, you'll be able to see as you're logged in as a user, over on the right-hand side, there's a form where you can submit your own success story. And if you don't see that there, we are always up for hearing about them, so you can contact us through any of the contact links on the page and on the website. And you can also reach Matt and I as well, and we'll have our contact information available at the end of this webinar. But we're really excited about this because we've been able to take some of the early lessons that we've learned from this project and really help to put them into practice. From the feedback that we've gotten from our previous users, this has really been able to help prioritize planning efforts. It's helped to identify where there might be potential hotspots for populations. It helps to inform decision-making, increase awareness, and can help build partnerships that can really influence the success of your planning. So for those of you who are continuing to build and strengthen those relationships, our goal is that this resource guide and the maps and the resources provided will help you work with those populations and the groups that serve them. The mapping itself can help to reconcile priorities and differences between perceptions versus actual levels of population density. So as Betsy mentioned, oh, well, we know where those populations are, but the metrics allow you to then ground those planning efforts in evidence to say yes, because those are areas where there are higher concentrations of populations. In planning for your community, for the whole community, it provides a tool that can help you begin identifying where those populations are, potential housing and transportation needs, how those might vary, and how minority status, language proficiency, how those may affect communication modalities across the various regions in your area. And so what we've continued to sort of wrap up, as we wrap up here, a lot of this really begins to hone in on the idea that this is about leveraging opportunities, to be able to leverage those resources into opportunities, whether it's being able to plan more efficient evacuations, whether it's identifying neighborhoods that might need services, to target community-based efforts, or simply apply evidence-based decisions to support your practice on a day-to-day. Really, what we see this project as being is simply one piece in a very complex puzzle. If it can help the whole community get prepared, stay prepared, and be ready, then we really have achieved some of our goals with this. We want to make sure that this project is able to help you effectively reduce risk in your area and help to mitigate some of the vulnerability in that access to resources. And in part of that, one critical key to that is that the work that we've been able to do is really only possible because of our partners. Making this tool useful and relevant to practice really has depended upon wonderful partnerships that we've had with King County, with Georgia, with North Carolina, with West Virginia, with New Mexico, with our 5 different states. We've really been able to make the guide what it is today.
So as Christine said, we want to specifically call out our partners that made it possible: the North Carolina Public Health Preparedness and Response, Eastern Band Cherokee Indians, Seattle-King County, who was on the line with us today. King County Office of Emergency Management was also instrumental in helping us out. The West Virginia Center for Threat Preparedness was another partner of ours, specifically the Division of Homeland Security and Emergency Management. New Mexico Department of Homeland Security, and finally the Georgia Department of Public Health, along with Georgia Emergency Management. So thank you so much, y'all. We couldn't have done it without you.
All right, well, we've now reached our question and answer period of our webinar. Many of you have been using the chat box to enter questions in for ourselves as well as our panel. And we're going to go through that list now and recognize some of our audience members and direct those questions to the appropriate panel member. And so looking through this list, one of the questions that we've seen in quite a few places is right now it's currently limited to 5 states, and whether we foresee this being done in other states, and whether data might be available through the website, whether it's going to, additional maps can be made available for those states, which is very exciting because we really would love to be able to do that. This project was made possible through CDC funding this past year, and our project year will end in September. And so right now what we're doing is we're also looking for those new partnerships and those opportunities to expand. So if you are interested in more information on how we can reach out to your state, in the follow-up evaluation, in the follow-up survey that you'll receive immediately after this webinar closes, there is a link to a request form. Not a request form, but you can click on that and let us know that you're interested. And Matt and I will be able to follow up with you personally and be able to talk a little bit more about what those opportunities might be for expansion. So as we go through some of these other questions, let us know if you're having any trouble or run into any issues. We're going to share also the site for the CDC team. They are available. That information is available on the, let me highlight that, Elaine just sent that in. And we're going to send that back out. So the CDC Social Vulnerability Index website, or the Social Vulnerability website, type this in here.
It's also a really easy website to remember. It's sbi.cdc.gov. And Christine's typing it into the chat box right now. Hopefully if you expand the control panel on the toolbar or go to webinar, you'll see that in the chat box.
Great. And so you can go there to view that. We'll also be sending out the link for the GoDogs, but if you go to your Google browser and type in GoDogs, G-O-D-A-W-G-S, GoDogs, that site was developed in partnership with the University of Georgia, hence the GoDogs. You can go there and see, register for that site to be able to see that integration as well. And then going back to some of the other questions, Louise, you had the question about what has been the most popular map that we've created, and what did local planners want most of all. And that's a very good question. As I'm going to go ahead and turn that question over to our 2 practice partners, to Betsy and to Meredith, and maybe they can speak briefly to which maps they found most useful, and me go ahead and Meredith, you're there, and Betsy?
Yeah, this is Meredith, and in our jurisdiction, transportation issues have become increasingly something we've been concerned about as a public health issue because of the barriers, obviously, that are created when there's a lack of transportation. And so Christine and her team were really fantastic in helping kind of break out, as you saw, the map that could show specifically the populations where they have less, when they don't have vehicles. And so for us, I think that that was an incredibly useful map.
Great, thank you.
This is Betsy. Can you hear me?
Yes, we can hear you.
Good. I keep working off my mute button. We have not really rolled this out yet. We are actually going to print up an atlas just for people to have in their hands because we haven't really rolled out the Go Dogs SVI mapping other than the one training session. And I think the most interesting and the most valuable for us is the fact that we can map the total social vulnerability, but we can actually do the 4 domains. I think they're called domains, and break it down so that we can take a look at housing and transportation separately, housing composition and minority status, and social economic status. The one thing that is missing in the coalition that I work with, we've been trying to sort of figure this out all along, is information on the disability population. And I know American Community Survey has some information, but we're still working on that and trying to figure out how to get down to the local level with that kind of data. So if anybody has any ideas, please send them my way.
Great, thanks, Betsy. Our next question comes from Fran Santagata, who I think is still out in Denver, if I recall from some of my previous work with her. And so her question, which I'm going to also ask Elaine and Barry to chime in on, are so that the populations are based on census data as well as American Community Survey data. And her question is whether there's access to individual contact information or whether the information is just global. And so the information that we have available on our site is in generalized tabular format. So when you go to the maps and data, you can click on the data tab to be able to view that. And I'd like Elaine and Barry to chime in on a little bit more of the data source behind this. And we'll have one more question after this, and then we'll wrap up our webinar.
Sure. The census data that's available online is what you see in our database. We cannot access any individual data. In fact, I think the most recent year for which you can access some individual data is 1940. It's about 70 years in between the time that they will publish that. Everything else is confidential. It's all aggregated to the tract level.
Great, thanks, Elaine. And we're just going through and seeing if there's any more questions that folks have. The information is the slides are going to be made available online in PDF format. For those of you who may have challenges and issues with linking to Dropbox, we'll make one that's a little bit more easily accessible through the project site on barkguide.com. We'll also have a copy of this webinar available if you'd like to share it or pass it along to those colleagues and partners that may not have been able to attend. We look forward to your feedback on this. We really appreciate your patience in throughout this process, since we have had a few hiccups today, but what's a live presentation without a few technical difficulties? So one of the last questions that we're going to wrap up here is going to be coming from Elizabeth. And her question was, are maps that we generate also visible or available for use by others using the site? That's a really great question, Elizabeth. Right now, those maps and and the data and bookmarks that you create are only going to be visible to you as an individual user. So you'll be able to see those. If you'd like to share them with others, then you can use that snapshot feature to be able to download that map image that you create. So if you say that you create a map for your area and want to, like I said, stick it in a PowerPoint presentation or attach it to an email or print it out and go wave it in front of somebody's face to help make your point a little bit more, you can print that. You can click on that snapshot tool and save that map by right-clicking and selecting Save Image As. So just like you would select any other image across the internet or other places, you can right-click and save that image. So with that, we'd like to go ahead and thank everyone for attending. Thank you so much to our guests. Thank you, Meredith. Thank you, Elaine. Thank you, Barry. Thank you, Betsy. We really appreciate you guys being here and being a part of this. We appreciate the support from CDC to really make this project possible with where it is. Thank you to all of our audience members for being a part of this today. We know that your schedules are very busy, and an hour and a half of your time is certainly can be a little costly, but we appreciate you taking the time to view this project, to be here, and hear about the work that we've been doing for the past couple years. And then lastly, as we wrap things up, please complete the post-webinar evaluation. That's where we have a special question in there. If you'd like to know more about how we might be able to expand the guide into your area, we are looking for new partners and new opportunities. We want to continue to make sure that this project is useful, that it's timely, that it's relevant. So please fill that form out, and then also be sure to check out the site and register. The link will be provided in that follow-up evaluation and that follow-up email you'll receive shortly. But if you have any questions in the meantime, if you run into any issues on this site, our contact information for both Matt and I is varkguide@unc.edu, and that's posted there. So please email us if you have any questions, concerns, interests. We would love to hear from you. So, with that, we're going to wrap up for the afternoon. Thank you so much for everyone for being a part of this. We appreciate it, and we'll look forward to posting this webinar online for your reference, and look forward to hearing from you and talking with you more about this in the future. Thank you.